Now, it is indeed a unique moment for us because we are on the anvil of a brave new era. Various advances in the field of otolaryngology has happened, but stem cell has remained elusive. And today morning, we have distinguished Dr. Pradeep Mahajan, who has been kind enough. He is into so many things, but in the middle of it, he has acceded our request and agreed to come online to share his rich experience in the various things that he does. We have been trying to contact various stem cell people around the world, but Dr. Pradeep is the first one to kindly consent to come online and interact with my PGs live. Now, I have 11 postgraduates with me, and they have a variety of questions, which I know Dr. Pradeep will answer. But apart from that, several heads of department professors in ENT across India, because we have this professors group, and many have expressed a keen interest to come online and interact with Dr. Pradeep. Why? Because stem cell is something that none of us have any experience thereof. We just read some bits and pieces here and there, but we are not really aware of any substantial work being done on stem cells. And it is indeed a privilege for us to have Dr. Pradeep here, who is running his own stem cell RX center in Mumbai. Welcome, Dr. Pradeep, on to this program.
At the onset of this today's CME, I would rather call an educational program because we are connecting to the academic program, not in a commercial program. So let me thanks Dr. Devin, Professor of ENT from AJ Medical College, to get me on your platform and open a new gateway to straight dialogue between the postgraduate students and ENT doctors to see the other corner of the research and science, which is not seen, or we would expect another 10 years to be a mainstream of science. This cutting edge of science is a science based on biology, what we call repairing kits of our body. The basic idea behind this is that science is never a static subject. Science is always a dynamic, which will keep on changing where we want or don't want. It will always contend with the boundary. It will always cross the boundaries what we can imagine, not controlling your institution, not controlling your boundaries of the state, not controlling your boundaries of the country, but it flows away over the continent. It is always breaking the boundaries and there are no limitations for it. So we are in the subject where science, which is dynamic, and most important, we have to be dynamic when we connect to the subject of science, because every day, which any media, whether you take an electronic media, whether you take an print media, whether you take an conferences, whether you take an CMEs, whether you take a CME of a primary subject like gastroenterology, whether you take a subject of orthopedic, whether you take a subject of ENT, there's always one lecture on regenerative medicine and stem cell technologies, which speaks how the science is changing from a mainstream of science to the new science. The idea behind this is that always remember, wherever, when we talk of a mainstream of science, which we are taught in the medical schools, where I am also belonging, because by profession, to introduce you, I'm a trained neurosurgeon, was at least 18 years associate professor, then professor of surgery. Then now I am an associate professor of regenerative medicine and stem cell technologies at Cooper Hospital, affiliated to Bombay Municipal Corporation. So I am trying to translate the new science into a mainstream, bringing in to understand the newer generation. Yes, we need to focus 10 years ahead, 20 years ahead, what is going to come, because in your clinical practice, Dr. Devin and your team will always might have come off some cases where you found in a mainstream science, it is very difficult to decide the treatments where you don't find results of them. One of them is a hearing loss, probably in ENT. I believe, Dr. Devin, you agree, there are no treatments where you give up with the patient saying that you have to live with this problem for the lifetime, except one technology, which is a cochlear transplant, which has come with all. Otherwise, most of the hearing loss subjects have got a lot of limitations. So there are in academic schools, when we are taught in the medicine, we are taught certain things which are changed today that we can call as changing dogmas of science. Like, I'll give an example to you. Before we start our question and answer, I'll make you understand why this is important. Like if you say sympathetic blood pressure control system, we were taught there are circular muscles in the capillaries, which are capillaries and arterioles and venules, which contract. But let me tell you, the new science says the circular muscles don't contract, but it are the pericytes which respond the contraction and maintain the blood pressure. Pericytes are a type of anchoring mesenchymal stem cell across the entire system of the body, where capillaries and vascular systems are there. They play a major role. Like in obstetric, we were taught the fixed dogma of fixed ovarian pool, and which exhausts towards the menopausal age around maybe 45, 50, where we say 5 lakh eggs get exhausted and woman becomes menopausal. It does no more exist. No more. It is the environment of the ovary which is atropic going because the non-response of the decrease in the hormonal response to the subepithelial ovarian stem cells. If we improve the environment of ovary, still you can maintain the ovulation post-menopausal up to 50, 60 years of woman, that is ovarian regeneration. Likewise, in ENT also, if you take the standard textbook, which is still taught, the hair cells are said they are permanently lost with the aging process or the damages with whatever we can call traumatic or toxic or whatever you can call like autoimmune diseases we can call, they are lost and they don't regrow. This is also a dogma. Now it has been proved embryonic cells could be transfected into hair cells. So these are changing stories of new science, and I believe all our academic students should get to know how this is happening. Once we come to molecular science of the biology, we come to know, yes, there is a possibility to overcome these 4 Ds. What are the 4 Ds? 4 Ds are diseases, damages, degenerations, and developmental problems, which are 4 Ds I called, which normally in mainstream of science, there are no treatments for damages, degenerations. You take any subject, you take a gynec, you take a neurosurgery, you take an orthopedic, you take an ENT, all these 4 type of conditions, that is degenerative, chronic diseases, damages, and developmental, that is genetic and development. We say there are no treatments. But let me cover you with the biological science, where I say we carry our repairing kits in our own body. When we say we carry on our repairing kits in your body, it does mean we have a repairing systems in our body. What are those repairing systems? Repairing systems are your master cells of your body. These master cells are stem cells. These stem cells, which play a major role in the healing process, I call them wear and tear, which naturally being maintained in the body. Likewise, example, you get a cerebrovascular accident. You get a post-chemotherapy infertility. You get a fracture injury. You get an abrasion injury. I'm taking simple examples. You have to, you may go to your physicians or specialists. They may give you a symptomatic treatment, but patient recovers of its own. This is called as a regenerative science, which is repairing system in the body. In my theory, I call them, can we convert these repairing systems of our body into therapies, where the pharmacological and physiological doses. Pharmacological doses means doses which are required for therapy, and for physiological doses means doses which are required for repairing, which normally are present. Likewise, if you take an example of platelets. Now, when you talk of a platelet, our physiological dose of platelet in the body is 2 to 5 lakh per microliter. Now, when we per milliliter, but this dose is a physiological. Whenever we get an injury repairing in the body, it's gone. These platelets are the first to rush to the site of repair and release their growth factors. These growth factors are like FGF, EGF, PDGF, VGF, FGF beta, TGF beta. All these play a role of repairing. Now, in a physiological dose, they do a basic repairing job. But the injury is more beyond repair. Then we require a pharmacology. In the disease is one where the body repairing system is compromised and reflects in the form of a disease. There we require a pharmacological dose. In fact, the science of regenerative medicine, that is why is applied not in only ENT. My practice being a neurosurgeon is applied to almost of staff specialty, for being that regenerative medicine applies to neuro, it applies to ortho, it applies to ENT, it applies to gastro, it applies to obstetric, is applied to talk of a body part, it is repairing. Talk of a system, it is repairing. And every organ has 3 layers of stem cells. Every organ. One, in the niche of the body organ. Second, bone marrow. And third, capillaries. These are pericytes. And all they play a major role in the repairing system. So why I'm bringing you to the basics of this is that once you know role of stem cells, we can apply to the subjects very well. Now, when I have said you, these stem cells belong in a 3 stage in the body. One, in the niche where progenitor cells are there, stem cells are there of the organ. Second, pericytes in the capillaries whole of the organ. And third, bone marrow, where a mixed population of cells are there. This mixed population indicates your progenitor cells, endothelial cells, stem cells, MSCs, hematopoietic, and most important, VSEL cells. These are called very small embryonic-like stem cells. Means we have a population from specialization to embryonic character in the bone marrow. Specialty cells to the endothelial cells. We have everything in this population there, which plays a major role in repairing. Now, when these cells are repairing in the every organ, how do we apply in our today's subject, that is hearing loss? I would request to all the participants, postgraduate students, I'll give a brief outline of the stem cells to you first, and then I'll take your questions. I don't have to talk about most of a hearing loss because you are all experts. I'll just brief you stem cells to you, and then I'll take your questions, and thereafter we can have further discussion if we require. Now, understanding the stem cells, always remember, stem cells are the master cells of our body. For you, I'm sharing a small presentation of stem cells for you, so as you will know what exactly this mother cell or master cell of your body is there, so that your most of the questions are easily answered for you. Just take this. Go ahead. Now, this is a slide which will show you what is your mother cell of your body. Human development goes into various stages. The single cell of your body, which starts as an egg in the mother's womb, is having a nucleus and a cytoplasm. In this mother cell, if you see, the cytoplasm ratio with the nuclear material is different, is reversed. There is a small ream of cytoplasm and a major cell of nucleatin material. This nucleatin material is a nucleus carrying 30,000 genes and a mitochondria having 5,000 genes. This cell has a potential to differentiate into 222 types of organs of our body. One. Second most important, remember, it has a differentiation potential to create the cells of 150 trillion cells by which our body is formed. Not only that part, the mitochondria has got 5,000 genes which play mitochondrial energy role in the cell division. We never think about it. Cell division is controlled by mitochondrial energy. So mitochondria has its own genome, nucleus has its own genome. It is a synergy of two cell lives to form a single cell life. Now, this cell, when it divides into first meiosis method, it gives same nuclear component into up to 16 cell lives. That is called as a morula, the second place. Now this morula, up to morula, we call them totipotent cells. The potency, I'm talking of potency now, totipotent cells. Here, once the cell divides by mitotic division, the nucleotide material is divided to half. Haploidentical. Equal material, it becomes not haploidentical, nuclear material. Only a small material of it goes into gametes, which divides with the haploidentical division, where the half of genes are separated. Whereas rest of the somatic cells will divide with the same type of division. And they form one inner cell mass, that is the third photograph, inner cell mass, and outer trophoblast layer. This is a time on 6th or 7th day where the ovum, this ovum or egg has migrated to the uterus. And it finds a fertile land on the endometrium to engraft itself. Now the trophoblast becomes the adhesion to the endometrium and develops the placental site on the trophoblast side and decidual placental side on the uterine side. Now here it doesn't stop beautiful. The science starts beautiful playing here. The inner cell mass starts expressing various 30,000 of genes into differentiating into CXXR1, which is the first gene expression, leading to the first cell in the body which differentiates is a neuron when the mother is not knowing even if she is pregnant. That is the time first differentiation takes place. Second cell which comes into existing is a differentiate is a immunological cells, that is MDC, that is monocyte-derived cells. This is very important because these two cells control the entire system of the body. That is immune system and neurological system. That is the reason they come first into play. And the cells will differentiate into various organs now. With third, fourth week, fifth week, sixth week, we start forming organs. Now, these differentiation with each expression of cells leads to an embryo to come to the self-vitality by 6th month. At the 6th month, the baby is become viable and decides that it can survive without mother up to 7th month. And at birth, baby is 2.5 kg. And at adult, it moves to 6 kg. This entire cycle differentiates into totipotency, the blastocyst, pluripotency, the organ differentiations, multipotency, adult specialized cells. Now, all these potencies depend on the differentiation potential. And if we see the sources of the stem cells, we can see these cells going in a bit differentiating into different organs, and totipotency, pluripotency, multipotency, and so. And if we see the types of them are two: embryonic stem cells and adult stem cells. Adult stem cells are found in the adult body, whereas up to the fetus, that is in the mother's uterus. Embryonic cells up to the 4th day, that is totipotency, and then comes the pluripotency. Now they differentiate the totipotency different into mesodermal, endodermal, and entodermal. Now adult cell sources, we have got bone marrow, adipose tissue, testicles are the germinal cells, which are haploidentical, whereas neural and teeth pulp are the other sources of stem cells. Apart from the stem cells and adult cells, what are other factors which control the differentiation in the body? Are like various growth factors. That is, these names are important because when you are going to answer me, when you are going to ask me questions, I'm going to refer all these terminologies. Brain-derived nerve factor, NGF, nerve growth factor, IGF, that is insulin growth factor, FGF, VDGF, MAPK, then PRPs, various growth factors, stem cells, mesenchymal cells, adult cells, exosomes. Exosomes are macrovesicles and various growth factors. Now, all these come under an umbrella which is called as a regenerative medicine, whose job is either regenerate, restore, replace, or repair. And these come as an allogenic cells, which are from the other sources, autologous cells from our own body, then various adult cells like chondrocytes, beta cells. Then tissue engineering plays a role between ECM, that is ECM is extracellular matrix, or you can say the matrix around the cell, and the cells, then cell surface markers, then MSCs, autologous cells, otherwise all other growth factors which are scaffolds. Emerging scenario for hearing loss when we want to see, what we know about the stem cells to apply in this regenerative medicine into hearing loss? Stem cell therapy, are we there yet to repair the hearing loss? Are we getting closer to cure the hearing loss? What are the secrets of maturing hair cells? There are 4 questions basically we'll keep in the mind when we are interacting. And before we go ahead our question session, I will show you 4 basic research papers since we are working on stem cells for hearing loss. Now, this paper shows 2012 first clinical trial approved by FDA, phase 1 trial of stem cells in hearing loss. Which means a decade we have started science of hearing loss using stem cell technologies. Stem cell treatment for hearing loss, what we know so far. Stem cell therapy has a potential to treat a number of conditions, including hair loss. When will there be stem cell treatment for hearing loss? Yes, I would say rather, today we are very close to get the cures for hearing loss. So stem cell therapy for hearing loss. Are we there yet? I would answer, yes, we are there yet. With subsequent answers, I'll get to you those research papers. Deafness cure, step closer to stem cells. Yes, we are very close to the cure of repair of the deafness. This is some kind of auditory neuropathy, a step closer for hearing loss, which is based a study of human embryonic stem cells in UK. Secrets of maturing hair cell, point a new treatment for hearing loss. Yeah. Are you hearing it?
Yeah, now we are hearing.
So, secrets of maturing hair cell point to new treatments for hearing loss. All these papers and articles give us an idea. Yes, we are on a right path to overcome the dogma that hair cells cannot regrow, which are the primary in the hearing defect or hearing losses to play. Stem cell therapy based approach, possible route for hearing restoration. Possible route means routes by which we can approach to deliver stem cells in the hearing loss. Routes of approach means the delivery system. What is the delivery system? Is to target stem cells or their healing factors or their signaling materials, which are called as the growth factors or exosome, to reach the damaged organs. I'll show some of them before we go ahead, which you could understand. Now, intravenous administration of human mesenchymal stem cell for noise or drug-induced hearing loss in rats. This study was done quite a long time before, somewhere in 2012. The model started of intravenous route with the general administration in animal model. Now, people have even used cord blood stem cell infusion for children with acquired hearing loss. Means the cord blood, which carries the embryonic cell-like population, as again an infusion in children with the congenital problems. This is a very good method in developmental causes, which I mentioned earlier, on developmental causes, particularly like hearing affected in the cerebral palsy patients, hearing affected in the autistic children, developmental problems, birth traumas. Yes, definitely the brain is developing. The cortical parts of hearing areas or auditory nerves where they are damaged. These help a lot by cord tissue or cord blood stem cell infusion. These are various ways which has been tried. Then experimental hearing drug loss exerts next phase of testing. These hearing loss, there are certain drugs which were also tested to have hearing loss. Stem cells and hearing loss. Again, here, how is the role which I explained to you? Now, how do we approach direct? If you want to deliver the stem cells direct to the target organs, not by intravenous route or not by intraarterial route or by general route, which I have spoken earlier, then we can directly through a fine needle of 31 French approach to the eardrum and deliver in the fluid levels in the middle layer. This as a transtympanic injection, the posterior and inferior quadrant. This is one of the approach where just below the oval window, this is delivered. Now, there could be approach intracochlear. Here, we could use not only stem cells, but various products which I have shown you of the stem cell, which I told you why I told you earlier, because these are the things we can be using like liposomes, polymers, cubosomes, chitosans, collagen, polysomer with the stem cells and mixed with it like these. They act as a scaffold to hold the stem cells in the cochlear cells, in the cochlear tissue, directly through the tympanic membrane. These are various methods. And one more method which I would like to show you today is intrathecal route. Intrathecal route, which is also considered in the patient with auditory nerve problems or auditory hearing areas in association, which I spoke you, cerebral palsy, autism, cerebral vascular accidents. Now, having understood the roots and the stem cells, I will keep the open platform now to ask the questions to me. And during the questions, if you have any more difficulties to understand, then I have a fantastic preparation of various type of stem cells, from mesenchymal stem cells, adult stem cell, progenitor auditory cells to the hair cells, which could be discussed out here, including growth factors, exosomes, and other aspects of regenerative medicine to apply hearing loss. Dr. Devin, it was a great experience. I would rather keep the platform open forum, which you expected your PG students to ask me questions.
Thank you very much, sir. Very kind of you. May I call upon postgraduates in descending order of seniority? We have 11 PGs, and first will be the final years. I call upon Dr. Amrita. May you ask your question, please? We have distinguished Dr. Pradeep Mahajan, outstanding regenerative medicine specialist from Mumbai. Dr. Amrita, please.
Good morning, sir.
Good morning.
My name is Amrita. I'm a third year postgraduate from Anchor. So my question is, what is the cost of stem cell treatment, sir?
Now, to coming up the any kind of commercial aspect of the stem cells, Amrita, we need to understand this is an upcoming science.
Okay.
This is still in the stream of what you can say translation. Translation means from benches to bed. The cost in the trials could be not even measurable, but cost in the therapeutic part when we do the treatment, it may range from few thousand to few lakhs, because this is as a precision science. This is a precision science. Precision means specific science. Customization and personalization to the treatment. Amrita, note down, when we look at the commercial part of it, we have to aspectly consider three factors. There could be a smallest cost, there could be highest cost, depending on three factors. One, you consider the morbid conditions of the patient, whether the patient has other morbid conditions, which are responsible to cause the primary hearing loss. Second, age of the patient, from a newborn child to the aging person. The regenerative drive and potential changes from the newborn to the aging person. So again, the cost differs. And third, most important, stage of the disease, where we can call is the early part where the moderate loss is there, where the hair cells are not completely lost, or there's not a complete damage, or if there's a hair cells are completely lost or a complete damage has taken place, both affecting the cochlear as well as the vestibular nerve. In that case, we can range the cost depending on personalization of the treatment. So you need to consider every patient separate in the cost factor. We can't treat patient like a paracetamol or ampicillin. Every patient fever, we give paracetamol or ampicillin if you have got fever. So the parameters will keep on changing, but definitely you as in postgraduate students always keep in mind when you are commercializing these technologies, you always consider translation as a science. One, second, all of the factors. So few thousand to few lakh rupees, depending on personalization or customization. In case if you want to discuss any specification commercial, it is not mandatory. It is a very expensive treatment. It is an optimal treatment where you can bring down the cost. We can escalate the cost. So please, you can discuss every case separately with your professor, Dr. Devin, and also discuss with me. I'll give a complete guideline of commercialization it. But we will make it affordable. The cost should be affordable to the patient is the first criteria. Got it, Amrita? If it is not affordable, then it cannot reach to the mass people. Is it clear in your mind now?
Yes, sir.
Thank you.
Well, whatever
you,
be the cost, for one cochlear implant in some centers, it costs nearly 12 lakhs. And if we can, at a fraction of that cost, get the hearing back, it will be a great blessing for the patient. Thank you,
Yes.
Amrita. May I call upon Dr. Vidya, please?
Good morning, sir. Myself Vidya.
Yes, Vidya.
So my question is there is any failure in stem cell transplant? If there is failure, how much is the rate, sir?
Vidya, in fact, if you, before starting on the question session, there is a very perfect reason to give the knowledge of basics of stem cell to you. Or one reason. We are talking repairing system converting into therapy. Now, when we talk of repairing system into therapy, it does mean I am enhancing the repairing systems of the body. The failure rates in these particular repairing systems are very, very, very less. If you customize, properly diagnose, and have a proper route of administration at proper stage, your success rates are more than 90-95%. These are integrated repairing systems. These are not only stem cells. So all these systems, we integrate the science from physical science of various therapies to these stem cells. So as your repairing enhancement system enhances to 3-fold, 4-fold, 10-folds. Because I told you, one is a physiological dose of every biological molecule and pharmacological dose of every molecule. Suppose you are repairing with the physiological doses, you have a failure. Got it clear? If you are repairing with the pharmacological dose, you have a less failure. If when we are using pharmacological dose, and if you are assisting with repairing systems like growth factors, FGF, EGF, VGF, NGF, BDNF, your repairing system will work more, still more regenerative potential will be increasing, and your success rate will be still more better. So try to analyze. Failures are there provided if you don't know the science. You approach wrong approaches and then blame the science. It is a failure. If you use a proper protocols with justification, which type of cells, which type of growth factors, and what stage, and dosing and the delivery route, I believe you will have more than 90-95% success rate.
Yes, sir. Thank you, sir.
Good. Can I call upon Dr. Vishnu, please?
Good morning, sir.
Good morning, Vishnu.
Sir, myself, Dr. Vishnu. I'm a 5-year postgraduate.
Come
My
again.
question is, what are the uses of stem cell treatment in ENT?
Vishnu, your voice is creating echoes. Can you just ask someone to off the microphones?
I'll do that.
Hello.
Yeah, Vishnu, you can continue.
Yes, sir. Sir, my question is use of stem cell treatment in ENT.
Stem cell treatment in
ENT.
ENT.
Yes, sir.
In oral ENT.
Yes, sir. ENT.
Okay. This is a very wide spectrum question. Definitely, I'll give a gross guideline to you. As I told you, there is no system in the body where there are no stem cells to play a role of repairing. When I talk of damage, degeneration, developmental problems, that does mean every organ has got these 3-4 things to happen. And ENT also plays a major role in the repairing system the way other organs are playing. Now, ENT, hearing loss, which we are today's topic where we are working on. Second, it submucous fibrosis, TM joints, arthritis, which plays a major role. Migraine plays a major role. Temporal headaches plays a major role. External ear pinna, which is degenerator or development problem, you can regenerate in the tissue engineering sector and use it. Ear canal developmental, then chronic infection, osteitis media, this one mastoid damage, then central hearing loss, where you can see the auditory nerve or auditory area damages. Then the new technology has come up, particularly ENT. If the auditory cortical area is lost or damaged, then we can use digital chips with the autologous neuroprogenitor cells to be transplanted in the auditory area, hearing area, and using blue chip to connect the cochlear system when the auditory nerve is damaged, where the another chip is connected with the cochlear system. Then also in your conventional main line of science, where we have a cochlear transplant, yes, mesenchymal stem cells with a growth factor play a major role of lifespan of cochlear system and the output of the cochlear system to enhance, which I have shown in one of the research papers where can be used. So a wide spectrum of application in the voice also, particularly you can say vocal cords, where you have a benign nodules, where a hoarse voice because of the large noise, large high pitched talk. You can use stem cells and growth factors, particularly growth factors, by nebulization technologies. When chronic sinus infections, chronic pharyngitis, then even what you can say, there is an what do you call it, Vishnu? You can from sinuses you get a growth in the nasal cavity.
Polyps. Polyps.
Polyps, even in polyps, where you don't require surgery if you use stem cells with the nebulization. Polyps, then turbinate enlargement, and most important, if you see my talks and one PPT presentation and some of the videos of ENS, empty nose syndrome, where physically when you see the patient, you find a hollowness in the nasal cavity, but the damage has taken place in the mucosa because of chronic fibrosis. This will not be seen in every patient of turbinectomy or this one septal dissection, but some of the patients you will find empty nose syndrome. Reason being that these patients have an molecular differentiation in the form of high level of fibrotic, that is MPP, that is metalloproteinase, which is increased level, and TGF beta increased level, where fibrotic healing is more, and new nerve endings in the septum and terminates, which are specially required for the sensing, are damaged more. Thereby, here you can use the empty nose syndrome treatment to regenerate the turbinate mucosa in angiogenesis and neurogenesis, so as patient resumes back his breathing, where he will not feel emptiness in the nose. This is one of the topic, my favorite, where I have done a lot of patients on empty nose syndrome. If any one of you are interested to understand the physiology of empty nose syndrome and how to treat this patient, I would definitely extend them and help them to treat this kind of patient, because this patient end up with a psychiatrist and go into mental what you can say, mental impairments and depressions. So this is one area where again we have a lot of scope to play with stem cells.
Nice. Can I ask Dr. Aisha, please, second year postgraduates?
Good morning, sir.
Good morning.
My question is, what are the legal problems associated with stem cell therapy?
Come again, question.
What are the legal problems associated with stem cell therapy?
Aisha, of all the questions, this question matters a lot for me. Very much important for me, particularly. When I come on the screen with all the group of people on dais, this is a question which should always come to the mind. Because regulations and legal things play a major role when we go toward the new science. Fortunate enough to discuss with you, I was one of the members who has drafted the guidelines of stem cell therapy for Government of India. So I can give a basic guideline for all of you of regulation and legal background of any stem cell technology. This is always spoken globally as a gray area, where still the regulations have not taken a complete framework. There is not a single country in the world which has defined all the regulations. When we talk of regulation, every country has got a different regulation, including India, like Japan, South Korea, US, Canada, UK, European Union, India, and South Korea. These are, and Germany even, are the leaders in the stem cell technology. Now, if you see the regulations, Japan is most advanced in regulation and clinical friendly. They have two classes. One is unmanipulated cells, second is manipulated cells. Unmanipulated cells means the cells are autologous, either taken from a bone marrow or a fat tissue or of peripheral blood, and without manipulation in the single procedure, I repeat my sentence, in the single procedure, if you use them in the therapy in the operation theater, this comes as a therapy out of regulation of every stem cell as a physician's therapy. Got it clear now? The second part of it, if you manipulate the cells in the lab in the form of using any growth factors, any chemicals, overnight proliferation or differentiation or genetic manipulation, or using extracellular matrix to different kind of developing the tissue matrices or tissue engineering, then it comes into regulatory framework. Third, now in case when you want to bring this molecule as a drug, that is using biological product, whether it is a stem cell or a products like growth factors, across the pharmacy counters to sell them in the market, then it comes under drug control, completely drug control. Now there are three frameworks, hope you understood now. Now three frameworks includes that commercialization as an drug, there has to be robotic technologies to produce in mass, because when we talk of a disease treatment, we require hundreds of patients. So producing 1 lakh cell, 1 million cell, 1 billion cell is not sufficient. There are millions of patients. So it has to be robotic technologies where you can produce symmetrical, consistent, reproducible, sterile, logistically transportable, stable, quality, and having the same potency. So robust technology are required under regulatory framework to produce as a drug. So there is a global forums which are working on this, particularly for MSCs and growth products or HSCs or some kind of immunological cells like NK cells, DC cells to come as a drug molecule. Okay. The second part of it, like when we use in your own operation theater, having the same patient cells as a homologous in the same part, like orthopedic conditions, using bone marrow for treating any arthritis or bone injuries is a homologous. You don't require anybody's permission. Got it clear now?
Yes.
Now, autologous, when we are using in the same theater by using centrifusion technologies, that is gradient. Gradient means this is density gradient. Density gradient is the technologies, but density of each cell from platelet to the cells to the MSCs and HSCs are considered with a different speed of centrifugation to isolate them and take them and directly treat to the targeted organ, are also out of view of regulatory framework. I believe I have made clearly to you to understand how to use in a framework stem cells. Am I correct?
Yes, yes.
Next question.
Thank you.
Can I call upon Dr. Panchami, please? Thank you, Aisha.
Good morning, sir.
Good morning,
My
Panchami.
question is,
how to train for stem cell treatment.
Come again, how to? Come again,
My
Panchami.
question is how to train for stem cell treatment.
How to treat?
Train. If she wants to train in this technology.
Oh, how to get training in the stem cell technology.
Yes.
It's a good academic part of it. Like, fortunate enough, my entire 10 years of life has been going into a research, and though I'm a practicing clinician physician, but when I found the next generation science is so much promising and changing the entire dynamics and future standing across the next generation. So I started working on this science. And if you are looking yourself to be in this innovative science, then there are two things. I always talk in my science saying, clinician is the best researcher. Clinician is the best researcher than a basic researcher who are doing PhD programs, because PhD program doctors who are working in the basic science doesn't have a clinical knowledge. So the translation is very challenging for them. But you as a basic researcher who has a translational knowledge of clinical side, it becomes very easy. So I would always encourage clinical doctors to take a research faculty and join as a research fellow for a year or two, complete the clinical research, basic research in a regenerative medicine and biology, so as you can apply this, translate this basic research into clinical applications. So for you to inform, Maharashtra University of Health Sciences, Government of Maharashtra, has started a fellowship program of 2 years for postdocs, MD, MS students at STEMRx at our institute. Joining the program is through Maharashtra University of Health Sciences through government application, which will be published in the Gazette, in the fellowship programs of the university. It's a 2 years program, which you can always opt. Otherwise, you can take up a certificate program with any of the institution who give you, including STEMRx, for 3 months or 2 months, and learn the basic science of regenerative medicine stem cells and think of changing your application into clinical side.
So if I recommend any of my postgraduates to train under you for 3 months, you will accept them, isn't it, sir?
Yeah, please, no problems.
Very kind of you. So there's a bright future for all my postgraduates. Thank you, Panchami, for that question. Can I call upon Dr. Anushri, please?
Thank you.
Morning, sir. This is Anushri, second year postgraduate. My question is, how many stem cell laboratories are there in India, sir?
When we talk of any kind of innovation science, have you heard a story of snake cells, snake oil, right?
Yes.
Now, when we talk, how many are there? So you need to be very, very careful and very, very selective to understand what are the right places where you can get this technology. Because when any science comes up, there are so many mushroom huts which are coming up, talking of stem cells. But please be careful when we talk of academic or research. So very few institutes are there in India where basic research translation takes place to the clinical sites, where you can say AIIMS has got a stem cell faculty, New Delhi, which is affiliated, our institution like STEMRx is affiliated with AIIMS for doing some clinical trials like exosomes for clinical trial non-healing wounds. Then STEMRx is one of the science place. Then there are institutions like Manipal Institution, where it is available also, postgraduate programs. Then there is an institution like functional medicine, infection institution in Calcutta, which also is a small program of a fellowship or diploma. There are no more like this institution which are government recognized, except these 3-4 of them.
So if we are keen on setting up a stem cell lab in our medical college, one of the largest medical colleges in Mangalore, and you would be open to partnering with us and helping us set up this thing, isn't it, sir?
We can definitely collaborate to set up your institute as a faculty separately, as a stem cell faculty with AIIMS has done. AIMS has a
Yes,
separate
yes.
stem cell faculty where we can plan up. It's a very good association, sir, from your side. We can do that.
Wonderful, wonderful. Thank you, Anushri. May I
Thank
call
you.
upon the next set of postgraduates? Can I ask Dr. Abhinandan? Your question, please.
Good
These are
morning,
all
sir.
first year postgraduates.
I'm Abhinandan, first year postgraduate, sir. So my question is, what are the contraindications for stem cell therapy, sir?
Very nice question, Abhinandan. I am really delighted because when you know what not to do, you do always correct. Understood question mine now? Answer. When you know what not to do, means whatever you do is correct. Now, this is a question very specifically for clinician is that, Dr. Deven, there was one question asked by our professor in surgery when we are students. When not to operate is a mature surgeon.
Yes, yes.
Than when to operate.
Yes, yes.
So once you learn what not to do, means whatever you do with that science is perfect. So let me share with you. You should understand where and which conditions stem cells doesn't work. Yes, definitely. Now, in case of malignancies, there is a loss of myth among the scientists and doctors. The stem cells treat malignancies. No stem cell can treat malignancy. On the contrary, stem cells proliferate the malignancies. I was asked this question by many people, many institutions, and many conferences. How we can use MSCs for treating cancers? No, you cannot use. Yes, you can use as a medium to deliver the drugs by attaching to stem cell a nanoparticle of drug molecule like chemotherapeutic, we can use, but they themselves cannot treat it. Second, there are conditions where you should understand limitations of stem cells. We are talking of repairing, not of regenerating the entire organ. Got it now clearly? So you should understand limitation. So do stem cells work, but within the limited framework. They cannot be promised that I can get your complete hearing, I can get your complete leg, I can get your complete function of liver, complete function of tissue. Not possible. Not possible. Got it clear now?
Yes, sir. Thank you.
Can I call upon Dr. Thank you, Abhinandan. Renshin.
Thank you.
Part of it has already been answered, I suppose. Dr. Renshin, please. Dr. Renshin, are you there?
Yes, sir. Good morning,
Yeah.
sir. So my question is, what are the commonly used sources of stem cell and how are they obtained, sir?
Okay, what are the type of stem cells and how they are procured? Am I correct?
Yes, sir. Yes, sir.
What are the types of stem cells? We divide them depending on the source, their potency, and their character of embryonic and adult. Embryonic stem cells are pluripotent, where you can differentiate the cell into 220 types of cells. Totipotent are the cells where you can create an entire human being up to 4th day of gestation. When it becomes a blastocyst, they remain pluripotent, where you can create the types of cell 220, but not the entire body. Then comes the multipotent, where you can have limited potency of 5-6 lineages like MSCs, are multipotent, where you can have 3 lineages like osteoconductive potential, then you can have adipose conductive potential, and third you can have vasculoconduction potential or myogenic potential. These are the 3 potencies, and there are adult cells which have got limited unipotencies once they are progenitor. Then from the sources, we can divide like allogenic sources from the other sources than ourselves, then autologous from your own body, and xenograph from the other species. The species other than human being like sheep and other goats and other sources. Then the organ specific like progenitor cells or pericytes. like liver-derived, the hepatocytes, bone-derived osteocytes, then nerve-derived neurocytes, like those specific to those organs. Now, potency-wise, organ-specific, source-wise are the various way we can define the sources. In adult, stem cells can be derived from the bone marrow, from the fat and peripheral blood, and dental. These are the 4 sources which can use it. Whereas in embryonic stem cell, adult cells derived from allogenic sources are the cord tissue, Wharton jelly, amniotic fluid, placenta are the other sources of the stem cells. Got it clear? And one more cell which has come up now, it is called induced pluripotent stem cells. Embryonic stem cells has a lot of ethical issues. So the scientists have used certain markers like CMAC, SOX2, and NOG for adult cell differentiating into biologically becoming embryonic stem cells, that is biological reversal of the adult cells into embryonic character, IPSCs, induced pluripotent cells. These are the various sources.
Yes, sir. Thank you, sir.
Good.
Next question.
Good. Can I call upon Dr. Pujita, please? Dr. Pujita. Are you there, Dr. Pujita? Well, I'll switch on to Dr. Chitra. Chitra.
Good morning, sir.
Good morning, Chitra.
Good morning, sir. I'm Pujita, first year postgraduate.
Pujita.
Yes, Pujita.
So my question is there any proven evidence of betterment of hearing after the stem cell therapy, sir?
Pujita, that is a very practical question, whether we can translate the stem cells therapy into clinical side or not. So before I talk, I would show some of the videos of my patient from a newborn to toxic or nerve loss, auditory nerve loss. Can you show them the videos?
That will be wonderful for us to see.
Yeah, please. I'm just showing some videos to you, which you can analyze, and then I'll explain how these stem cells have worked in this patient. Because in this case, I have explained you the routes of application. I told you the success and failure rate, one of the student has asked, and I have given a very specific answer. You can be always failure, provided you use a wrong route of application, wrong cells.
Yes.
You can be always successful, provided you use the right route of application and the right diagnosis is there. And what is about the route of delivery of the stem cell is very important. I showed you intravenous, cord blood, middle ear, cochlear, or intrathecal. Remember 4 routes, and depending on indication, you have to use them. So I'll show you one case of the newborn baby. No, the one I thought. Voice. Now, this baby, when I was treating, is the youngest in the world of 11 months, not even 11 months, 9 months, for cerebral palsy. Her baby was of the weight of not even 1 kg, 1 kg 500 grams. The problem of at this month of 9 to 10 months, the baby should hear properly. He used to not look at the side. He used to not even could sleep because of the lack of hearing. The mother is telling in Hindi. Now, this particular case, the good news to give is that is going to come in the Indian book records for treatment of youngest girl in the world for hearing defect at that age with cerebral palsy. And now the baby hears completely normal. Now here, as I told you, failure and success rate. Now somebody may say, I would have delivered directly in the middle ear. I would have directly delivered in the cochlear implant. Remember, there was no problem in the system. The problem was in the development, where the auditory system was underdeveloped completely and was not developing to the extent where the child should have picked up the hearing systems. Now, what we did in this child, 2 routes of application. One was intrathecal. Got it clearly now? Now, intrathecal, my target was to the entire auditory area and the auditory nerve, which was working here. And the second was few drops of autologous VSEL cells, very small embryonic like stem cells, which has got an embryonic character, which was showing the smaller than the size of RBC, that is 2 to 4 micrometer. RBCs are 6 to 10, which are of capillary size, whereas VSEL cells are 1/3 of the size of RBCs, where they show complete embryonic character. They are isolated by a centrifuge technology with a density gradient from the bone marrow. And these drops in the eardrum, on the eardrum. Now you could see I sandwiched the system completely between the 2 sources of delivery. Could you understand? Now there was no operative, no invasive procedure. And within 3 weeks, the child, when was given assisted integrated systems of like matrix, very intense pulse pressures, and intravenous doses, and exchange between hypoxic and hyperbaric. Changes hypoxic and hyperbaric pressures little bit, maybe 20 minutes, 20 minutes, 20 minutes, 20 minutes. The entire body was ingenerated with the stem cells. And within 3 weeks, the child started hearing. So the application, precisely I told you, the therapy protocol had to be very specific to get the success. And the child is growing now with good normal hearing. And I would also, if somebody wants to interact the parents, I'll also arrange that.
Yeah, the child's video, is it possible to see, sir?
Yes, we can show the video, child's video. Check from YouTube and show the complete.
Meanwhile, can we see any other video of people who have recovered? The voice is not clear. We can't hear you.
He's arranging.
Sure.
Yeah, start video. Yeah, this girl is an Gunjan, is from Haridwar, has affected with methyl alcohol optic nerve, complete vision loss. Now she has opted to understand various colors and shadows after 4 weeks of sandwich protocol of stem cell along with various stimulations, the optic area, like auditory area, which I showed you, optic area. Now you can listen to her questions. She is showing the directions where and what.
Okay. सर के हाथ का पोजीशन कैसा है? Okay, दूसरा हाथ. Very good.
ऐसा कट क्यों कर रहे हैं? पूरा बताओ ना वीडियो. Show the from YouTube, no video.
So, but the screen wouldn't be visible.
The painter showed me. The second video, take it. I'm showing you other videos because she has prepared a small clip for the talk, but I'll show you the full videos.
Yeah, please, sir.
Yeah.
Because it will be fascinating for us to see unbelievable things.
Condition where neurosomatic systems are affected, where the brain and vascular system of the skin is affected. They belong to the one epidermal, this one of the mesoderma, endoderm and ectoderm. They belong to ectoderm developmental problem, where the brain and vascular system of the skin are affected. Now, this baby is from Uganda, was diagnosed with Stuger-Weber syndrome. This was a big news with APP Maza all over India. I'll show you news write-up also and a small clip here subsequently. The mother speaks about her baby.
Alpha is really fairing. He can laugh, he can sit, he can do everything. Oh, and I have a lot of things to say, but because I can't finish up everything, this improvement is the happy boy very young to see. Because he was once one. Thank you, Symmetrical. Thank you, Dr. Mahajan.
I'll show you the complete videos. This I have prepared a small clips for you to show during the talk process, but I'll show you the complete videos. Next. Show them avascular autism. These are some interesting.
I'm here like for 21 days, and now I can see the changes in baby. Like she can hold her neck, and wrist is also okay. Height is probably 80 or 81, as doctor has said. और उसमें बहुत changes भी है. और previously इसका जो था वो इसका जून में feet start हुआ है इसको, और feet में भी बहुत सुधार है इसके.
Now this baby was of 14 months. This was a national news in Doordarshan about the youngest girl than before this 11 months baby I treated. This is the Abhay, which I told you about hearing loss and development. I'm showing you a full video of the baby. Before and after. Voice. The mother is trying to this is before treatment.
Maybe alpha is also there.
Full video that you show.
Yes, full video
There's a
also
news.
there.
I
Yes.
want news.
News videos also there.
News video. Show. No, you can see the response of baby. The alpha issue. Alpha fluence.
Full videos on YouTube.
Share. Share it on the screen. नहीं, वो नहीं, मुझे न्यूज़ चाहिए। न्यूज़ वाला बोलने के बाद मैं क्यों बता रहे मुझे? अरे आप बोलने के बाद।
Yeah, one case of profoundly deaf child advised cochlear implant, but with stem cell has recovered. Would you have any case?
That kind of case is right now not with me.
Okay. We come across so many individuals with sensorineural
See, sir,
hearing loss.
Every case we have to individualize, and then we can work up a separate protocol for that. Now, this again one alpha I am showing you, which has got a hearing problem from the birth and development because of the neurodegenerative and syndromal, that is genetic problem was there. And it was a national news, which I'm showing you now. Could you see?
इस बीमारी का इलाज दुनिया में कहीं नहीं हो पाया, उसका इलाज हुआ है भारत में। जी हाँ, युगांडा से आए एक दंपति के 18 महीने के बच्चे को ऐसी बीमारी थी कि पूरा शरीर काम ही नहीं कर रहा था। दुनिया के कोने कोने में इलाज नहीं हुआ। भारत आने के बाद बच्चे की दुर्लभ बीमारी का इलाज हुआ। लाइलाज बीमारी के इलाज से मेडिकल साइंस में भारत ने नए मुकाम को छू लिया है। अपनी मां के साथ मस्ती करते इस बच्चे का नाम अल्फा है। अल्फा अटखेलियां कर रहा है। मां की गोद में बैठा अल्फा उछल कूद कर रहा है। माँ बाप के चेहरे पर भी खुशी साफ झलक रही है। पूरा परिवार खुश है। अल्फा के माँ बाप भारत और यहाँ के डॉक्टर्स की तारीफें करते नहीं थक रहे, और हो भी क्यों ना, क्योंकि हमारे देश ने कर दिखाया है वो जो पूरी दुनिया नहीं कर सकी। दरअसल अल्फा 18 महीने तक दूसरे बच्चों की तरह सामान्य था, लेकिन अचानक एक दिन अल्फा बीमार हुआ। बुखार इतना था कि शरीर में अकड़न आ गई। अल्फा ठीक से सांस भी नहीं ले पा रहा था। अल्फा के माता पिता फौरन डॉक्टर के पास ले गए। दुनिया के कई डॉक्टर्स के साथ लंबा इलाज भी चला, लेकिन हालात में सुधार होने के बजाय अल्फा और बीमार होता चला गया। सीटी स्कैन और फिर एमआरआई हुआ, जिसके बाद युगांडा के डॉक्टर्स ने उसे भारत रेफर कर दिया। भारत आने के बाद पता चला कि अल्फा को ऐसी बीमारी है जो बहुत दुर्लभ है। अल्फा को स्टर्च वेबर सिंड्रोम यानी कि SWS नाम की बीमारी है। दुनिया के अधिकतर डॉक्टर्स इस बीमारी के इलाज से हाथ उठा देते हैं।
The time reached when actually most of his cells were destroyed, and most of his brain parts were functioning anything. He could not sit, he could not talk, he could not do anything. Saliva was coming out.
SWS ऐसी खतरनाक बीमारी है कि अल्फा अक्सर बीमार रहने लगा। एक दिन अल्फा का सर झूल गया, ना वो बोल सकता था, ना ही कोई हाव भाव रह गए थे। शरीर में अकड़न बढ़ने लगी थी। अल्फा और उनके माता पिता भारत आए और स्टेम RX बायो साइंस संस्था में इलाज शुरू करवाया। स्टेम आरएक्स बायोसाइंस के डॉक्टर्स की माने तो अल्फा का इलाज स्टेम सेल थेरेपी द्वारा लगातार 1 महीने तक किया गया। स्टर्च वेबर सिंड्रोम नाम की इस बीमारी में कोशिकाएं नष्ट हो जाती हैं। स्टेम सेल थेरेपी से इन सेल्स को रिपेयर किया गया और अब अल्फा ठीक हो गया।
इंडिया का पहला केस है, सुजल वेबर सिंड्रोम इंडिया का सबसे पहला केस है। और इस बच्चे का हमारा पूरा प्रोग्राम 1 महीने का था और 1 महीने में वो बच्चा जो उसका 21 महीने का जो लॉस था वो पूरा भर कर दे चुके।
1 महीने के लंबे इलाज के बाद अल्फा अब सामान्य बच्चों जैसा हो गया। अब अल्फा मस्ती करता है, खेलता है। माँ बाप भी बेहद खुश हैं क्योंकि उनका जिगर का टुकड़ा अब ठीक हो गया है। अल्फा के माँ बाप को भारत देश से प्यार हो गया है। यहाँ उनको न सिर्फ प्यार मिला बल्कि उनके बच्चे को एक नया जीवन मिला है। आज वो लोग फिर से युगांडा अपने देश लौट जाएंगे, लेकिन भारत और यहाँ के डॉक्टर्स की सुनहरी यादें हमेशा अपने दिलों में रखेंगे। मुंबई से मृत्युंजय की रिपोर्ट।
ये है ABP न्यूज़, आपको रखे आगे।
This is the child is almost become normal, isn't it?
Absolutely normal, absolutely normal. He's growing now.
Yeah.
They keep on sending me recent photographs also now. The child is growing.
But these are things which should be given national prominence and introduced to all pediatricians, and we are not aware that even such miracles are possible.
So these are the one which I have brought it as a national news also, research paper also I published on this. Even in type 1 diabetes, I have got a lot of successful cases. Even publications are there by Christian Medical College.
So if, I mean, would you have a normal adult who is profoundly deaf, maybe like, for example, post
Yeah, I have got
meningitis?
some of them. I have got one was a patient. One of the patient was from this one, Kashmir, who has an autoimmune problem and suddenly loss of hear. A traumatic, large voice induced, they can respond very well.
And now I had personally requested you, what is the, and of course you had said various parameters have to be assessed. So if we were to send a patient to Mumbai, you would assess them using your team of specialists and then come to a firm opinion.
Yes, I'll discuss with you. I'll give the guideline also. Never promise extra to the patient. My basic question is no promise to the patient of extra things.
Yeah, they can just come and have a proper evaluation and give it a try.
And then we can evaluate what is the percentage of recovery. Very well. There is no 100% recovery to every patient.
Yes. Now, so the thing is, you know, nowadays, powerful digital processing hearing aid costs about $1 lakh plus.
Yeah.
And so in that regard, if somebody wants to come to you, what should I tell them around the approximate cost might be?
So you can define the case from the various 3 factors, whether he will require a local delivery or intravenous delivery or intrathecal delivery. That will differ the cost. Like even in cardiac case, I'll give you an example. Suppose I had to give IV, the cost is less. If suppose I had to give intracoronary, the entire cost is escalated because we are doing invasive procedure to reach to the coronary arteries. Similarly, when we go to target delivery inside, then we use various systems to deliver the organ.
Yes. So which means I'm seeing a miracle in unfold, which means even for stroke patients, what is the
very good result? Stroke, I have got a lot of, unfortunately to share with the entire team. In a stroke, in the month of April, I can make you join with one of my co-partners from US, Dr. Ajay Seth from Ohio is an orthopedic surgeon and a principal investigator and vice chairman of the Indianapolis University, Dr. Chandan Sen. Getting into a technology with StemRx in case of upper limb paralysis. Upper limb means both extremities, right and left. Within 6 to 8 hours, the patient can use his arm, complete flaccid arm, into a functional arm for eating food, taking a cup of tea, buttoning the shirt. All those things are possible using stem cell technology and digital technology, digital chips.
For example, in a right-sided hemiplegic patient, right arm, right leg is paralyzed, aphasic, no voice, and post a stroke, if they were to come to Mumbai, and how long would they have to stay there?
3 to 4 weeks, sir.
Okay, and you would have some arrangement with some guest house.
Yeah. Everything is arranged here, sir. All international patients come and we make them have a complete logistic system.
Yeah, and for a stroke patient whom in my family there's somebody, if I were to tell them in 4 weeks time the total cost might be this much, and the
around 3 to 4 lakh you can say, sir, not more than that.
Yes, and you
Plus
have had even after a month after stroke, you have had patients who have almost completely recovered.
I'll give an idea in these kind of patients for all the students.
Yes.
See, it is a process of regeneration. Process of regeneration you cannot achieve complete in 3 to 4 weeks. Now, 3 to 4 weeks is the idea where you have a confidence that my patient can become correct. And this correct definition is called as ADL, activities for daily living. What is daily living activity? He should be in a position to take care of his clothing. He should be taking position of his own fooding, a commercial aspect of livelihood, commercial aspect of personal care of his hygiene. All those things are possible to the basic line. Okay. Thereafter, we want to target specific function. Then we target that specific function of the brain to improve from intelligence to motor areas. Now, this technology is added with physics. Physics is a digitalization. Second, blue chip technology. Bluetooth technology with digitalized chips. Even if the tracks are damaged, like visual track, auditory track, motor tracks are damaged as a massive damage, but cortical area is functioning, then these tracks can be replaced by blue chips technology and target the organ where you want to function to the cortical area. These are all possible things and have been done with my counterpart in US. So I'm working on one patient is central cortical loss of vision, very VIP patient. One patient I'm working on a motor area loss of the upper arm, where I have promised him that he can use his arm within hours for the basic needs. But the technology will be over a period of time, maybe 1 or 2 years. The technologies of functional electrical stimulations converting to digitalization and stem cells could be make a paralytic patient to stand and walk.
Absolutely amazing. What about vitiligo?
Beautiful results of vitiligo. Beautiful results. Is an autoimmune condition again.
If my postgraduates and myself want to study your various results, is there any website or YouTube channel we can look into?
I will send you my websites and my research papers and publications, as well as my YouTube channel, so that you can go through it, read their success stories. If you have any questions, I'll send my email address to all of you. You can send me question. You can continue interaction with me so as to remove confusions. What is possible, what is not possible.
What about hepatic failure, sir? A patient had TB meningitis, given tuberculosis drugs, the drug toxicity caused liver failure.
I'll explain you. Hepatic and autotoxicity post tuberculosis and hepatic damage. Always remember, toxicity caused by drug is repairable. There are two conditions. One, where is a partially non-functioning cells, and second is totally died cells. So we don't expect died cell to function, but partially functioning cell can take up a full function. One. And new generation of stem cells, new generation of the adult cells from the progenitor cells, which is possible. Now hepatic, one of the hepatic is the biggest challenge for become, because hepatic cells are most unstable cells. Again, I repeat my sentence, most unstable cells. To develop hepatic cells in the lab is most difficult. World has tried all over the world, but the few labs have achieved in Japan and US to achieve hepatic differentiation. But making them stable is still more further investigation. But in vivo, when we talk in vivo means within the body, which is much possible. But in vitro is a challenge. But in vivo, when you want to use, you can deliver particularly MSCs derived from placenta, not primary from the placenta, but epidermal layer of the placental cells. Epidermal, again, I repeat my sentence, epidermal placental stem cells has a potential of hepatic differentiation more than other cells. If we take out epidermal placental cells, proliferate in the lab, go into hepatic artery with angiography and deliver them, you will have enough of hepatic regeneration. Along with that, if you use VSEL cells and VEGF, vascular endothelial growth factor, and very small embryonic-like stem cells, you can have enough of differentiation of hepatocytes to overcome the hepatic transplant.
So in this regard, cardiac failure patients can expect a full recovery?
Sir, I'm again repeating, there is no question of full recovery. Clinically adaptable recovery. Clinically adaptable recovery. Suppose the damage is 90%, you can expect, suppose this ejection factor is suppose 30, 20, we can go up to 35, 40, not like 60 normal. With 35, 40, if he comes, he can have a normal quality life instead of going for a angiography or angioplasty or anything else.
And these, in this cases, you inject directly into the cardiac myocyte?
You can go through two routes. One is in general, second is through cardiac route, through angiogram, coronary arteries. The third route, going into myocardium, is an invasive route where you have to do open surgery, which I don't recommend.
Yeah. You're doing God's work and must have enough publicity, and because so many people are not aware of what all is possible.
Yeah, sir, thank you for recognizing me. But one thing is, sir, it is a process of learning. It takes little time, but we can achieve most of the things in kind of when we know we have a repairing cells in the body.
Now, is there anything that you can do for height once the epiphyseal closure has happened?
Before epiphyseal closure, you can have a very good result for the height. But after epiphyseal closure, you can have a minimum benefit, maximum few millimeters, because there is no length more upon epiphyseal closure because of the bone lengthening.
Yes. Would you have a stem cell bank so that it can be given to anybody without any immunological reaction?
A very nice question, sir. For all the students, remember, there are two types of stem cells we consider in our bone marrow as a majority. One is a mesenchymal stem cells, which has come in the fold. Arnold Kaplan is called as the father of mesenchymal stem cells. In 1990s and 80s, he was the one who defined our bone marrow has got two types of cells. If you go back to our standard textbooks of the bone marrow in medicine, Harrison, it will still show bone marrow has got one type of stem cells. Those are hematopoietic stem cells only. They don't refer to mesenchymal stem cells. Now, the new edition of Harrison has started showing mesenchymal stem cells in the bone marrow. The earlier edition, which when we were studying, I don't know you guys who has got Harrison today, whether they have shown this the existence of mesenchymal stem cell. It was in 1980s and 90s where Arnold Kaplan showed the existence of one more type of cell, mesenchymal stem cells. Mesenchymal stem cells are the cells which are relatively important for the repairing of the mesenchymal tissues. And these cells don't represent HLA markers and MHC markers. MHC minor marker is only represented and HLA-DR is represented. HLA-DR indicates the at the time of mother who is protecting the baby from rejection, HLA-DR. Whereas HLA, other types, HLA-B and markers, which are remembered, the specific immunogenicity markers for transplant, they are absent in all MSCs. MSCs are not immunogenic but immunoevasive, means they pass on the immune reaction of the mother or donors. They can hide themselves and come. That is they called as a immunoevasive, not immune free, immunoevasive.
So the problem I face, 5 cochlear implants we did, 1 failed. That created so much of noise because they so much of expenditure and so much of hope. But it failed because the child had auditory central processing disorder, which we were not able to evaluate and identify. And in that case, so the concern is, after all that, if it does not succeed, I come from a very violent area of India called God's own country. Suddenly the patients will become so violent, it is not easy to handle them.
Sir, in this case particularly, if the cochlear implant has not worked, we have to see where is the defect. Target the mapping of the track. Target the mapping of the track. Now, since the central system is not functioning, if you take, I believe you take out the case history of this patient. We will discuss this, sir, because this case will show the central processing system is not functioning well. Means
Absolutely.
the problem is the cortical area.
Yeah, which we were not able to evaluate upfront.
So that we can do. What you could do, sir, take a PET scan.
Yeah.
To evaluate
Brilliant
the
idea.
cortical. Huh?
Brilliant idea.
Take a PET scan.
Yeah.
It will give you a functional and PET scan or a functional MRI.
Yeah.
Functional MRI will show the functional activity in the cortical area of the hearing.
Absolutely fantastic.
When the patient is made into action. If these two scans we do, an auditory nerve tracking, auditory nerve tracking, these three investigations if you do, I will find out a solution to give him some hearing ability at the cochlear.
Yes. Yeah. Now, for this intratympanic injection, if we arrange a patient here in Mangalore, would it be possible for you or your team to come down to Mangalore and do the procedure here?
We can, sir. We can do that. Not a problem. Once we can individualize the cases, we can collaborate and we can do all those things.
I will come to
specifically
Mumbai, and discuss with you in person. But in the meanwhile, many of my postgraduates are now keen to observe your work for 2 or 3 days. They can come and observe your work or be in touch with you when they come to Mumbai, because we have now.
They can.
Super.
They can.
Now we come to Dr. Chitra, who is there with us. And Dr. Chitra, what's your question, please? Thank you.
Good afternoon, sir. I'm Dr. Chitra, first year postgraduate. My question is side effects of stem cells, sir.
Chitra, it's a very nice question. Theoretically, if you read on Google, if you become a Google researcher, there are a lot of side effects they will mention, like tumorigenicity, rejection, differentiation, other tissue possible. There is a possibility that there is no benefit. There may possible in future it may go into a wrong genetic character. All these are possibilities which are mentioned in the Google textbooks. Am I correct?
Yes.
Have you read?
Yes.
Now remember one thing, stem cells function is monitored by the environment, not by the stem cell. First principle you should learn. Stem cell or adult cell personally cannot do anything without having a conductive environment. Means the environment is responsible for the stem cell function, not the cell itself. First principle. Second, tumorigenicity is based in the master stem cell, which is at the level of the niche of the organ, where the stem cell is differentiating into two ways. One is symmetrical division, second is asymmetrical division. What is symmetrical division? Symmetrical division means the cell is dividing into two baby cells into adult to replace the dying adult cells. Got it now? And asymmetrical division is one where the cell is dividing into progenitor cell to maintain the pull of a stem cell into organ, and one is differentiating into an adult cell. Now the cell at this level, when the cell is differentiating into asymmetric division, again I repeat my sentence, asymmetric division, where the chances of mutation caused by the environment of that niche having more than 150 mutations at a time at the nuclear level, cytoplasmic level, cytoskeletal level, mitochondrial level, or organelle level. Are you getting me? If there are 150 mutations, these 150 mutations can lead these stem cell into a cancer stem cell. Not the adult cells, other adult cells and adult stem cell can go into cancerogenicity, tumorigenicity. Got it clear now?
Yes.
Very few people know all these things. So the history of dogma saying cancerogenic factors, like which we are taught in a textbook, is no more standing as a carcinogenicity. Cancer comes from a cancer stem cell.
Yes.
Not from an adult cell. Got it clear now? As far as your question, what are the other complications? Differentiation. Many people ask me, sir, if this cell differentiates into, we have given a bone and it becomes a liver, it becomes a brain. I already very well said you, the cell differentiation is controlled by the environment, not by the cell. If the cell is delivered into a target organ or lodges into a target organ like myocardium, the myocardium is responsible, the environment ECM, to differentiate into myocardial cell, not into hepatic cell. If it is delivered into liver, it has to differentiate into liver progenitor cell only because the environment is responsible. Got it clear? It cannot differentiate into any other lineage. Third, it is possible it may not function because the environment may be not healthy cells to differentiate because it could be inflammatory. It could be a possibility that extracellular matrix has collected unfolded proteins more so that the cell cannot survive more, or the cytoplasm has collected from endoplasmic reticulum, which has got mRNAs to produce the protein molecules instead of taking properly shape the proteins to differentiating into specific function. If they become unfolded proteins, I repeat my sentence, unfolded proteins, which are non-specific, the cell cannot function. Got it clear now?
Yes. So, but yes, but it's a little scary as well to convince patients, and in today's Google or Siri area.
Sir, it is a challenging field. When you become passionate and the results what you do and the molecular science as a biologist and as a clinician, it's a fascinating world.
Yes. So anything can be done for premature graying?
Yes, very
hair
well.
gray.
Now these two children were premature one, which I showed you. One is one on
No, hair gray.
Yeah, gray hair can be done because there in hair gray, remember one thing, the somatic cells or epidermal cells of the skin, which is called as a follicular cell, has a potential of differentiating into 5 types. One is a very fast dividing epidermal cell, very slowly dividing the cell which is called as an sweat gland cell, very slowly dividing. And this depends on the environment which is around the follicular cells.
Yes.
Now, if the follicular cell environment goes into TH1, TH2 imbalance and Treg cell suppression by repressing the FOXP3 and CD25 protein, the inflammatory ratio increases and the cells go into apoptosis. When the cell goes into apoptosis, like it could be a leukodermal melanocyte, it could be a hair cell, it could be any cell like psoriatic cells, psoriasis of the skin where uncontrolled divisions are going. These are the basic philosophies at the epidermal level in the dermal part of his cell we have to understand.
And psoriasis can be cured?
Yes, we can cure. Because it is also again an uncontrolled division. It is like a pre-malignant. It can be done using the control system using MSCs as well as some molecules which are responsible to get a balance between TH1 and TH2.
And there are patients on your trial as of now who are psoriatic?
Yes, I got patients, alopecia areata, leukoderma, which are working on it like. And there is one more technology which I am bringing in month of May will be there, which is called as a TNT. For all the PG students, they can note down tissue nano transfection. This is an in vivo transfecting the somatic cell, I repeat, epidermal somatic cell, into a melanocyte, where the environment, once the melanocyte cells form, gives an environment to differentiate other epidermal cells into melanocytes. This is one in line using mRNAs, 4 types of mRNAs, which will be transfected into somatic cell using a technology which is called as electroporation and digital chips, silicon digital chip.
The reverse can be done also. I can become like a very fair European color.
Yes, sir. Without realizing the patient also that it is an integrated approach.
Yes. So there are other programs that you are now planning or in seeing. You have a program on how one can achieve living up to 100 years.
Yeah, that is called as ageless life.
So can you tell us a bit, 1 minute about what it is fantastic to understand and listen.
This ageless life is an aging program. Aging program as per Ogdebre, who is a senescence scientist in UK, speaks about the aging of a cell. Aging of the cell depends on 7 factors. One is DNA degradation. Second, increased DNA methylation. Fourth, accumulating in the cell unwanted proteins, which are supposed to go into protein specific. Accumulating unwanted protein in extracellular matrix. Mitochondrial dysfunction. Loss of telomerase length. Loss of telomerase length, which is very important because every cell has a cycle. I don't remember the word that is called as a Yash cycle or something like that, as Yash cycle, which has a specific function of the every cell to divide up to 50 times. At the 50th or 50 plus cycle division, the cell loses the cap on the telomers. Telomers are the caps on the telomerase gene. The cap is lost, and the cell, this length of the telomers become very small, and further division stops. The maintenance is done by telomerase enzyme. Now, if we work upon these 6 factors, the cell don't have to go into senescences. Now, other molecules which work are empirically working on mitochondria, which goes into dysfunction to reverse the function of the mitochondria back to normal. Chaperones, which remove the heat shock proteins that HSP65, HSP104, HSP95, which are responsible for the function to produce folded proteins from unfolded proteins. Then removing the extracellular vesicles, which remove the extra bad proteins from the cytoplasm. Third, improving the cell-to-cell communication to cell-to-cell contact or through satellite molecules, which are called as in extracellular vesicles, which transmit the function from one cell to other cell. So if you work on these principles along with integrated science of using circadian rhythm. Circadian rhythm is a rhythm which works between the sun and earth cycle, which gives the cell function without mutation. The mutated cells are to be targeted one at this level when circadian. Second, cells which are becoming senescences, apoptosis cycle, they go in apoptosis cycles. Cells which are going into proliferation into adult, they produce anti-inflammatory immunomodulatory cytokines, which are important for the cell to functionally grow. Whereas cells which are becoming senescences, going towards the death, they produce all pro-inflammatory molecules and apoptic molecules, apoptic extracellular vesicles, which lead the cell to the death. If we remove these two things and use these principles which I spoke just now, possibly we can achieve ageless life.
So based on that principle, all my postgraduates, if they follow you, they can expect to live till 100 years?
Very much, sir. Very much. I don't find any reason. One thing always remember, you have to, when we talk of ageless cycle, along with the cell cycles which I described you, the most important part remains on the intestine.
Yes.
The intestine plays a role to absorb unwanted proteins, which plays with the microvilli and the microbes of the intestine, which play more often cytokines, chemokines, and neurotransmitters, because 70% of the immune system of the body is controlled by intestine. Yes. 70% neurotransmitters of the brain come from the intestine.
That's true.
Immunomodulation takes place in the intestine. A huge immune system is there in the intestine. If you maintain this, probably, yes, we can work.
Yes. So my area of interest for a while was chaperones and telomerase, which you have mentioned just now. I never ever thought I will come across another person with that specific knowledge and interest. Now, one sentence I have to say, I just have to say hats off to your knowledge, because the amount of data that you have shared with us is unbelievable, and I doubt there's anybody who can match your knowledge in all these micro areas. It's absolutely fascinating. We have one more postgraduate, Rohan. Dr. Rohan, your question, please. Thank you, Chitra.
Thank you, sir.
Good afternoon, sir. My question is regarding offshore stem cell therapies. And how is it regulated and monitored?
I just spoke, probably there are not. Regulatory systems are very important in new coming science. I told you it categorized into 3 forms. One, minimal invasive. Second is moderately invasive, and is a highly manipulative. Minimal invasive technologies where autologous stem cells and homologous cells, they come out of the preview of regulation by the stem cell authorities or regulatory bodies like CDSU or DGCI. Okay, whereas you little manipulate the cells in the form of differentiation, proliferation, they come into a DGC regulatory and ICMR regulation where you have to prove that cells are safety first and efficacy later on, and then you can use clinically by through phase 1, phase 2 clinical trials. And highly manipulative means where genetic manipulations are there, transdifferentiation of the cells are there. There they come under a scrutiny by ICMR and genetic team, which is conductive from the DBT and ICMR and ICMA and DGCI will approve the technologies and go through the clinical trials before we bring into bench to bed.
So Rohan, what was your intent of, when you said offshore, what did you exactly mean? You said offshore.
So like there are a lot of stem cell therapy clinics outside as well.
Oh, you're
Not
asking
only
about the
in
clinic
India,
outside
and
the country.
people,
You're talking the
yes,
global stem cell clinics.
yes, sir.
Rohan,
Yes.
keep in mind one thing. Very well, I said you. Snake oil is a concept which is always spoken in when new science comes in. You will find a lot of clinics in Mexico, particularly. Caribbean islands you will find. You will find some of them in Bangkok also. China also. Most of the clinics know me personally in all this way. Even in Ukraine, some of the clinics are there. Okay. Now these clinics, they work out of the preview of regulation. That is the reason their programs doesn't define molecular differentiations. Yes, body repairs, to some extent you may benefit, which people claim. But you should always find right clinic where you can justify the scientific evaluation for results. So when you select an stem cell clinic, it is not only delivery of the stem cell. As I told you, personal assessment of the patient with 3 factors, which I explained, target deliveries and count of the cells and specificity of the cells are important with integrated cells. So there are few clinics globally very good, particularly in Japan. Yes, I agree. Korea, NK cell technologies in Japan are very good. Cell sheet technologies, which are partners with me in Japan, also are very good. They also have a lot of good technologies to work on it. In Mexico, there is one good clinic affiliated with the STEM Medica in California.
You just mentioned one growth promotive factor of retinoic acid. And I saw one report of 13 cis retinoic acid regenerating inner ear hair cells.
Yes,
Maybe
there is one paper here, correct. It is one of the factors which could deliver directly from the middle ear.
Yes, yes, yes.
Yes, it can do,
So,
correct, sir.
Yeah.
Along
So
with
now,
that retinoic acid, along with retinoic acid, there are other factors which you could always take help of FGF and PDGF and VEGF to help to retinoic acid more.
Would there be a stem cell solution which we can directly apply it to a broken eardrum to allow it to regenerate instead of undergoing a eardrum repair surgery?
Again, I'll explain you, sir. Eardrum is having minimal vascularity.
Yes.
So compromised vascularity has got a lower healing rate. So in that case, what you could do, the collagen-based product along with VEGF, you can place. It may help to regenerate drum up to some extent, not the entire drum.
Good, good. Now
If
there are various other
damage, you can repair it.
Yes. Now there are various other people on this forum. If anybody wants to ask questions, it's a wonderful opportunity. If any postgraduates have new questions have cropped up, it's a fantastic opportunity to have a pioneer of stem cells in India talk to us. He's been so open and kind, and he has shared a large wealth of knowledge. He's even thrown open the opportunity for you to go and visit and see the fantastic work. If you only specialize in this just one area, postgraduates across India are now with me, and go and set up a stem cell. That is a unique opportunity. A small, tiny area and be the world's best. Dr. Mahajan sort of would be kind enough to help you on a partnership basis, maybe set up centers across India, because that will spread his work far and wide. If there's any question from any member of the group, either please put that in the chat area or unmute your mic and ask directly, because you can't get such an opportunity. I've not heard any stem cell work or interview or anything. This is the very first time I'm interacting with somebody of such profound knowledge, wisdom, grace, and excellence. Thank you, Dr. Mahajan, for sharing your a wealth of knowledge and a large amount of time. Nearly 2 hours you have been on the forum. I will what happens, now many faculties are all held up in their clinics, and later in the night they will ask for a recording. So I will share the recording with you and the rest of the faculties. And if there are those who are interested in carrying that work forward or referring patients, I'll give you a contact number as well. It's absolutely amazing to see a urologist branch out into regenerative medicine and then develop a fantastic array of techniques and technologies to give mankind a relief from what humans are suffering from. Thank you so much, Dr. Mahajan. May I ask my postgraduates to give Dr. Mahajan a very big hand?
Thank you, Dr. Devin, giving an opportunity to be here with your postgraduates and colleagues who are in ENT experts. I'm always there for you to guide in future how to take up our life into a very future scientist.
You are taking us to the next level of evolution in human scientific endeavors.
Thank you, sir.
Thank you, sir.
You're welcome, sir.
Thank you very much. Thank you.
Thank you.
Thank you, sir.
Thank you, sir.